I suppose in a way, because I've been in the UK and I've had to do self-isolation and testing. Do you think there's a level of complacency on the Isle of Man? That obviously someone like myself and students, we've been used to being tested and isolating, so it kind of gets used to it. Here, we've only had, 300 odd active cases in total, Do you think there is a level of complacency that we don't want to test and hand sanitize and wear masks if appropriate, obviously?
Well, I don't think there's a thing about we don't want to test. We do want to test, but it's making sure that the testing we do is actually appropriate and provides the data that we need. So, for instance, as I've said in interviews with Paul before, I would be in favour of surveillance testing around about day 10,
so why,
day 12,
why isn't this being introduced?
And that is what we then need to start looking at, how we do that. But you also, like I say, if we're not going to mandate testing, where you get into all sorts of legal issues, then realistically, if you're going to get valid data, you need a large uptake of people taking that test, and the only way you will get that is if there's some benefit to the individual of having it. So, for instance, if we introduce day 10 testing, do people get a different form of isolation for the next 4 days? Because if you just say to people, well, you can have a test on day 10, but you've still got to isolate for 14 days before you can come out, why would you take a day 10 test?
Is this the reason why not? I mean, you've been saying for a while about this. You're in favour of surveillance testing and a day 10 whatever test. I mean, why isn't that happening? Because we hear there's plenty of capacity in the testing facility. Why is it taking so long to get the testing in place?
Because, like I say, at the moment, there would be no benefit to the individual of doing so. So we believe the numbers of take-up would be quite low.
So then at what stage then do you introduce it?
So as the UK infection rate starts coming down, then we can start looking at modified self-isolation for people. And that would allow us, like we did with 7-day and test, to be able to offer it to people to be able to access.
I think it's quite interesting because you're not saying, because I think in a way you're sort of saying, well, the take-up wouldn't be great, and we can't force people to take a test, is what you're saying. So all I'm asking is, if that's the facts, then when is that going to be introduced? Surely it will never be introduced if that's what you're going off.
Well, no, it will be introduced because it's based on the UK infection rate, same as before. So when we believe the risk, because let's remember, there is a risk factor. So even with day 10 testing is about 98% accurate.
Yeah.
So it still carries a 2% risk factor in the fact that you will have people who are positive for COVID-19 but will actually pass the test. So we have to take that into account, and the more people who are coming from an infected region,
of course,
the higher that 2% effectively, the chance of that 2%. That's why we got rid of the 7-day and test, which carries a 6% risk factor. So as the UK infection rate comes down, obviously that risk factor comes down at the same time, and that then allows us to look at the options around day 10 and potentially some form of modified isolation.
Okay. Mr. Ashford, something else. The medical advice you were given to do with the Comas Hotel, I think I'm right in saying that's still not being released to the public. Am I right in saying that?
The advice that was given to council and ministers, yes, because it forms part of political discussions, and as is traditional in most governments, that it does not really advice is not released in that way.
Because I believe there was a question in Tynwald, it might have been a month or two ago, I think, about this, and the Chief Minister, I think, said that we weren't going to give it out as such. I mean, would you personally be happy for that advice to be released?
No, when it's policy forming advice, I don't think it should be released, because like I say, it's traditional.
But is it still forming policy though? Because surely that was
it still forms part of what was the policy advice. If people believe at a future date the advice they give in the formation of policy is going to be released publicly, and people will be able to look at it with the benefit of hindsight, then basically why would you won't necessarily give the honest and frank advice that you would otherwise, because officers will be looking at how they believe their advice will be perceived in years to come. That is the same in most other jurisdictions. It's exactly the same in the Republic of Ireland. It's exactly the same in the UK. Anything that forms part of those discussions remains private.
It's quite an interesting point though, what you're saying. So what you're saying is a medical practitioner would potentially alter their advice to government based on public opinion. It's basically what you've just said.
It's quite possible that advice, or they wouldn't put in certain advice because they'd be worried about how it is perceived in years to come.
Okay.
That is a fundamental principle that underpins most governments.
Absolutely. I appreciate this isn't particularly medical, but we were talking about TT and talking about the economic benefit that also presents. I was reading some interesting figures from last year, and it was about the census. The fact that the Isle of Man has now got a significantly ageing population, but the younger 18 to 29 group has been literally going like that, essentially, down. Why do you think young people aren't relocating to the Isle of Man?
Well, I think what you tend to see is people come back after a period, and that's not necessarily picked up. So I'm a prime example of that. I went to university and then I stayed and worked in the UK for about 4 or 5 years after I'd finished university before I came back to the island. So what you don't tend to get in the figures is how many people after a while come back and then restart families. So they don't necessarily go to university and then come straight back. It's a big wide world out there.
It is.
People
I mean,
want to go and experience different things before they end up back on the island.
That's right, but surely, I mean, I think the government wants to increase population. I think it was 110,000. I think, wasn't it, a couple of years ago? That was announced. We're not going to increase it if we just live in this. Surely, if we live in the mindset of it's all right, you can come back in your 30s and have kids and whatnot. Surely, we need to be focusing on that age group particularly. And increasing more opportunities.
But it's increasingly hard to get that age group to come back because it is a big wide world out there and they want to experience different things. This isn't a challenge just faced by the Isle of Man.
No,
it's a challenge faced by jurisdictions around the world.
But surely the Isle of Man could be the game changer.
And what is very interesting is if I look back at my university cohort that went off island, and I think back to how many of us came back immediately after university. It was a very, very low figure. But now most of us are back on Ireland. You just tend to get it, and I don't think anything you do will ever actually change that because young people will want to experience careers elsewhere. And in fact, sometimes getting them back at a later date is actually to the advantage of the island because they've been off elsewhere, they've got work experience and they've progressed in the field that they want, and then they bring that great range of work and life experience back to the island at a later date.
You've done very, very well for yourself. I mean, just to finish on that,
I don't know about that. I ended up as Minister for Health and Social Care.
Well, you get plenty of letters, but I think. Do you think? I mean, students got a bit of a hard time over COVID, and there's still some aspects of the Manx community giving them painting them with a brush. Essentially, they bring COVID back to the island. Do you think the Isle of Man generally, and particularly the government, does enough for students and to encourage students back to the Isle of Man?
Yeah, I think we do where we can. I know Department for Enterprise has been working very hard on saying, come back to the island and even keeping people on Ireland. I know there's been a lot of work in the Department of Education where when you think about where courses and things were about 10 years ago compared to where they are now and what's available on Ireland, you can stay on Ireland and do an awful lot more than you could 10 years ago. But the big challenge is we've got to remember we are a small jurisdiction, a very small island. We are never going to be able to deliver everything on Ireland, so we are always going to have that cohort that have to travel off. But I believe there's been huge progress made over the last decade.